administer it. They already keep costs down with their HMOs. But what we should do is get the federal government through the president and Congress and say, listen, what's good for us is good for you. I'm going to give you the same price. Why can't they do that for? You know why they won't do it, ma'am? Because the insurance companies don't want that.
Yep.
And they pay a lot of money, ma'am.
That's right.
To the politicians. So there's a conflict of interest. The tort lawyers pay $238 million to the Democratic Party. And the insurance companies got to only know what they paid. And they're paying also the Republicans. They pay everyone off. The question is, it's time you say cahootas, whatever, cojones. Cojones. You get your cojones.
If you want true reform.
You want true reform, you got to bite the bullet and say, listen, I want everyone to benefit from this. Give us a good deal.
We're willing to pee off all our donors and know that it's going to hurt us politically because we're getting a lot of political contributions. But if we want true reform, this is where it's at.
That's exactly right, ma'am. Absolutely. And Blue Cross Blue Shield Federal is the best, ma'am, when you're out there. You can go anywhere you want in the United States and get care for you or your family and get the things you need. And by the way, we are regulated, even with Blue Cross Blue Shield. We don't order all these unnecessary tests quote all the time because if you don't have an indication, they don't pay you. Now, the federal government's not telling you that either, by the way.
All right. Hey, Nikki, thanks for the call.
You're welcome. Thank you.
All right. Bob, welcome to the program.
Hi, Bob. Hi, Dr. Vitarello.
How you doing?
Hey there, sir.
I have a question. You're a cardiology group. How much is your health insurance? How much is your medical insurance?
Medical malpractice?
Yeah.
Check this out. $120,000 I pay.
$20,000.
$120,000.
Okay, so that's $10,000 a month is your premium for malpractice.
Yes, sir. Minimum. Okay. Now they're increasing again.
As a percentage of your employees, what's the percentage of your employees that do nothing but administrate, do no clinical, but do nothing but administration on basically fighting with the health?
That's a fantastic, great question. We have 8 employees that simply fight with insurances. Can I tell you a little trick of the industry? We submit bills electronically. Every month we get 10% of all our bills denied saying we never submitted it, even though we have the electronic record. Do you like that?
Yeah.
Yeah, it's a game they do. They don't pay us. And what they do is they also, check this out, if you see a lot of patients, they don't let you get tests done until 72 hours. So the more patients you see, the more they delay your testing. Isn't that a great thing?
Yeah.
And they're so huge. We actually had them come to our office saying, why are you doing this? This is, well, basically it saves them money. Because guess what? If you have a lot of patients and if you don't watch your bills and you get denials, after 6 months you can't collect on them. So they make a lot of money who doctors are too busy taking care of patients, not resubmitting the bill 3 to 4 times.
As my understanding, they have tricks called coding.
Oh my God, coding tricks are unbelievable.
Wrong, and I understand that they basically have classes to...
Absolutely. That has happened to us, by the way.
To delay claims.
Right.
And percentages, whatnot. The other question I have is fee for service.
Yes.
You have obviously people that come in that have the cash to pay for your services.
Well, actually, I mean, the cash, okay, the percentage of my patients that pay cash for their full services is maybe about less than 1%. 70% of my practice is Medicare, and I accept Medicare. So basically, the patient pays 5% of the total bill, which is not much. My average office visit, sir, if you come to my office with a Medicare patient, it's about $50. That's it. I get $4 for an EKG. So that's what I get paid by Medicare. A heart catheterization, I only get paid $280 after 17 years of training. And my docs are in there in the cath lab dealing with high risk, we get $280. My plumber, after a couple hours, equals that. So we're not making a lot of money, and they cut back our fees 34%. So you're saying is like most people come in, get fee for service, we submit the bill to Medicare, and we accept what Medicare pays. And even though it's not the greatest payment, at least I get paid, but I don't get cash from patients. If people come in and they don't have health insurance, I write it off. Like I told you, Mission of Mercy, I just don't charge them. If they have a full-time job, I make them pay basically, check this out, 25%, 30% of what Medicare pays me. I'm not there to make the money. If I did, I would have been a trial lawyer, okay? So most people do not pay cash when they come to see a cardiologist. It's all done through Medicare, which is 70% of our business. So Medicare for me is a good thing, and the federal government doesn't tell my patients what they can have and have not done. That's between me and the patient. But the new public health care option will tell me what I can do and not do with you as a patient. And I'm against that. How do they know who you are? Just because you're 74 years of age, you might be built like a 50-year-old for all I know. Yeah. So I'm against the government telling me how to take care of you.
All right, thanks, Bob.
Thank you.
All right, and by the way, first of all, you don't got to apologize to me. You should make a lot of money. When my fat butt's up on that table and I need somebody to save my life, I don't want somebody that, I don't want some mediocre person that doesn't want to, be successful in life. I want somebody that's going to get up there and has the training and wants to get the job done and save my life.
That's cool.
I hate to hear when they say that. Well, doctors make too much.
Read the Washington Post, Blaine. It came on Sunday. It's a case of getting what you pay for. Basically, the new angioplasty patients.
There's greed in every profession.
Absolutely right. And what we need to do is basically get what you pay for. So basically, keep it fair and keep it simple, but don't ruin it by having the government running your health care.
All right, Good afternoon, Frederick. Welcome back to the Blaine Young Show. Been talking about health care. Dr. Vitarello, Chief Cardiologist, Frederick Memorial Hospital. I want to thank him so much for coming on the program. We are going to have him back as this discussion continues. The most important thing you can do is pick up the phone and call U.S. Senators Ben Cardin, Barbara Mikulski, Max Baucus, and Senator Charles Grassley. We'll get those numbers on the website for you. We have about a minute and a half left, Doctor. I'd like to give you an opportunity to finish up and wrap up the discussion for the day.
All I'm asking you as the people here listening to us today is that you're the patient. You're the most important thing for us now, and you shall always be the most important thing for us doctors. What I'm asking you to do is this. When the Senate comes back and they take their recess, please, they're going to be able to read the bill, which they haven't done yet. There should be a synopsis of the bill online. Call these people up and tell them no to a public option. You don't want the federal government making medical decisions for you and your family. The only person should be making the decision is the patient with his or her doctor only. And that's the best way. We've been doing this for the last 100-plus years, and we don't have to break a system right now that has the best care in the world to save money and then get taxed more and waste more money in projects that don't make sense. This is not a bridge to nowhere. This is your health care. And one day, myself or Blaine will be on that table when one of those seaport doctors, they're trying to save my life. And I'm not going to ask them, are you here or not? I want you here. I expect you to be here. No ifs and buts. So I want the best to be there. Keep them there. We want the system to be reformed. We went over things we want to do, but make it fair for the doctors, the nurses, and as well as, most importantly, keeping it safe for the American public. So say no to a public option and say yes to reform that's reasonable. And tort reform, raise your voice and say enough.
Dr. Vitarello, thank you very much. We'll talk to you again very soon. If you missed any of this discussion, you can go back tomorrow, WFMD.com. Click the Blaine Young Show. Stay tuned for Glenn Beck up next on 930 WFMD.